Welcome to the office. Hi, Jasmine.
Hi.
Welcome.
Thank you.
So, what are you doing here? How can I help you?
I have like a lot of sciatica, kind of hip, glute pain going on and lower back, and it's going just down my leg.
Okay.
Um,
Started when?
it started a few months ago. It was when I was like cycling and running a lot because I had an injury last year in my like calf ankle area on this side that I don't know if it fully recovered, and then I started training again, and then the calf ankle was okay, but then this like hip sciatica lower back area started really bothering me.
A year ago.
Yeah, this like
you injured the calf a year ago.
yeah, it was like here and here that I like felt
Do you
it.
remember what you were doing?
I was hiking Mount Whitney.
Okay.
So I was like coming down and my ankle kind of rolled a few times.
So you did sprain the ankle.
I
Or roll
think.
the ankle.
Yeah,
roll the ankle.
Yeah. I didn't really get it like checked out. I just kind of rested it. Like I couldn't run because every time I would run, it would buckle over. So.
Okay, because of weakness or pain?
No,
it just buckled.
Yeah, it just buckled.
Did it hurt when it buckled?
No, it just felt weird.
Fair enough. Okay.
Yeah.
Now, that was the year ago.
That was in July of last year.
Okay.
Yeah, and then I didn't run for a while, and then I started running again in January or February, like January, because I had some races coming up that I wanted to start training for.
What do you do?
I do triathlons.
You do triathlons?
Yeah.
Okay, is that your hat right there, the South Bay Squad?
Yeah, that's
awesome.
my team in the
Very
South
cool.
Bay. So.
How many people do you train?
We have like over 40 people on the team right now, and then I'm coaching a different workout every day for them. So it's a lot of.
And you're still doing that right now?
I am. I'm not doing the workouts. I'm just coaching them. Like I'm standing there telling them what to do.
You're observing.
Yeah.
Okay.
Yeah.
I get it. Okay. Cool.
I can't. Yeah, because of all this going on.
So that was a year ago. That was back in July.
Mm-hmm.
January, you start running and training again.
Mm-hmm.
Tell me then what happened.
The hip glute thing started bothering me in like March when I was
during an event, during something specific.
Just training. I was like
you woke up like it, or you kind of gradually knew something was off?
No, I started feeling it kind of bothering me because like I also got a concussion at the end of 2018 from falling off my bike, and then since then I haven't been able to activate my hips and glutes properly.
Okay, well that's actually really important.
Yeah.
You had a concussion when?
End of 2018, where I fell and hit actually the left side. Everything's happened on the left side of my body. My disc at the age of 11 from skating, my concussion.
Skating, skateboarding, or?
Ice skating.
Ice skating.
Yeah.
Okay.
So yeah, everything's been on the left side.
Okay.
And then, yeah. So that concussion changed a lot of things for sure. Because I had to do a lot of like therapy for it, like the eye work or whatever to get
hand-eye coordination. You had to do a lot.
My balance was off. I couldn't even stand like with 2 feet on the ground and close my eyes. Like I would
How did you get a concussion, if you don't mind me?
I fell off my bike, and I have a video of it actually if you want to see it. But
you can share it with me.
Yeah, it's my like friend has like a GoPro on his bike, and it just happened to catch me falling. But my bike got caught in the middle of the bike path. There's like a little divide.
Yeah.
In the middle, and it was like just wide enough to fit my tire. So my tire got caught in it, and I just went straight down on my head and my hip here.
Down on the left side.
Yeah. Yeah, I was like right here. I hit really hard, and then I had a bump on my hip for like the longest time too. I think you could maybe still feel it if you dig.
We'll take a
here.
look at it. Let me ask you though, did you get treatment? Did you get evaluation?
Yeah,
besides
I did.
The medical?
I did PT for a long time to like try and reactivate the hips and glutes, because after that my athletic performance has never been the same. Just I've been completely different after that.
Are you able to activate the glutes now?
No.
Oh, so this would be good for us to figure out.
Yeah.
Okay, now we're getting to this. So I'm trying to understand something. So you had a lot of PT done, stretching, reactivation, post-isometric relaxation, stretching, Balance exercises, I'm assuming. Balance
A lot.
board, rocker board.
Yeah.
You surf?
No.
You got a little surfer vibe, but okay.
Oh, interesting.
No problem. Okay, so you did all that. It didn't reactivate the glute, but it helped other stuff.
It did. Like it reactivates sometimes, and then it goes back to sleep, and then it'll reactivate and then go back to sleep. So like, it also depends on like my kind of autoimmune stuff. Like it's all kind of
Let's
connected.
talk about what's this autoimmune stuff you're talking about.
7 years ago, I lived in Asia, got really sick, like fever, stomach issues, fatigue, and then they kept taking me to the hospitals there, and they thought I had malaria, and they couldn't figure out what was going on.
Okay.
And then came back here, doctors did a billion tests, diagnosed me with a billion things, and I was on antibiotics and different medication for like years.
What was the main medication you were on though? If you don't mind me
I
asking.
don't remember because it was a while ago, but it was like stuff for Lyme disease, for SIBO, for like chronic recurring like infections down there, like just all these infections. I was just on different antibiotics and stuff.
So you were getting a lot of infections. I mean, his immune system was weak.
Mhm.
Got it.
Yeah.
Okay.
So then I started going the more natural, like holistic way, just changing the diet, lifestyle, taking herbs, doing kind of like the more emotional, spiritual work and
Good.
stuff. And I've made a lot of progress, but there's still, it's like no matter how much progress I'm making, I feel like my body's still not letting me fully like release everything, and I don't know why. Like, I mean, it could be structural, it could be
Emotional.
something
It
emotional.
could be
Yeah, I'm
whatever.
not sure, but I do know I'm getting closer and closer. So
Are you ready to figure it out?
yeah,
All right.
it's been
Okay.
over 7 years, so
Okay.
I've just always felt out of like balance, kind of my whole life. Not even before like my health stuff. So
Okay. You grew up where here?
and yeah, like in Palos
South Bay.
Verdes, yeah.
Okay.
So born and raised
So
there.
Asia was just kind of going.
It was just a summer internship before my senior year in college.
Okay.
So
Awesome.
Yeah.
All right, we got some stuff to figure out.
Yeah.
Anything else you want to share with me? Relating
That's
to this hip and the injury and anything like
I think that's it.
that. What did Jay tell you?
He said that if anyone can fix me, it's most likely you. So
Well, hopefully we can figure out, get some answers.
yeah,
And I know you've been to a lot of doctors.
yeah,
You've had a lot of things said.
yeah.
I'm going to keep it simple.
Yeah.
Okay, because you need the result.
Yeah.
Now, from what I see, we'll go over it. It may be a little spicy.
Okay.
You know what I mean by that.
Mm.
Adjustment may be a little spicy.
Okay.
And icing is going to be really important.
Okay.
Is your breath off too? Your breathing?
Yes. Everything's
I
off.
see this. The septum is off too. You want me to deal with that too?
What's that?
Your deviated septum. You have a
Okay.
slight septum.
I do? Sure. Whatever you see is off, you can have
Okay,
at it.
so let's figure out where we're going to start today.
Okay.
It's not about cracking all these different things. It's about
Yeah.
figuring out where the nerve pressure is,
Okay.
what's out of balance in the foundation, and figuring out where we're going to start today.
Okay.
Okay?
Sounds good.
Let's do it. Come on over here, please. Well, this is you. This is your side profile. This is looking at you from the side. This is looking at you from behind. This is the right side. This is the left side. And first thing I want to do is look at this posture. You ever do a plumb line, or in any of the PT places, they ever do a posture assessment? Typically they would run a plumb line where the ear matches the shoulder, the hip, the knee, and the ankle.
Maybe. But
Okay.
I don't remember.
So I do it based on the x-ray. We
Mhm.
use the lowest lumbar and we take it straight up. And the first thing you're going to see is your posture is off. Your upper body sits behind your foundation. That line is supposed to be going through C2 there and through C7. So what this is showing us just in the posture, this upper body, so it should curve like this, and come like that. This line should actually go through there on the top.
Wow.
So what that tells us is your upper body, this being behind, these muscles are all working off balance. They're just trying to keep you up. So you're sitting, standing long periods of time, you're getting it across here.
Mm-hmm.
Okay? And that's your posture. Okay. We'll get back to that x-ray in a second. Now let's go over this one. And this is how I want you to think of it. This is how I explain it. There are 24 bones in the spine, 23 discs in between, and this is the foundation of this 24-story building. I like to think of the spine as a 24-story building with 24 movable bones. The foundation, in order to have a stable building, we need a level base and foundation. So let's look at your foundation and let's see what we find. We definitely have digestion issues we need to talk about.
Yeah.
Yes,
my
ma'am.
GI and my, yeah.
Yeah, we'll talk
Bad.
about it. So this is your right side. This is all undigested food here, by the way. All this.
Great.
And all this. This is undigested food within the gas. What I first want you to see is you have a old tailbone injury. You have a bend in your sacrum. Do you see this curve here? So this, then it kinks like that, then it comes back. And let me do this. You see it's right there and here. The way it came, but the poop is blocking it. So let's go to the side. And let's look at it from the side instead, and let's look at the tailbone. And this should make a lot of sense. This is supposed to be a smooth arc curve. There's a straight, there's that nub. 1, 2, maybe 3. So you had some good tailbone falls.
That's definitely from skating.
That's the one that stands out. That's most significant to me in terms. This is also, because that's the kink. But that's the old injury. That's the callus that formed. Okay? That's about S1, S2. That's S3. This is S4.
Okay.
Okay. And I know you know the mechanics, like you know the body, the parts and all that stuff. So if something doesn't make sense, please ask a question.
Okay.
Okay? All right, cool. So first thing is we have a bent tailbone. We're going to probably be starting in your tailbone. Let's talk about the numbers here and what do they mean. And they're actually not so bad. There's actually a lot of good news here.
Good.
So quantifying it, we look at the numbers. And the way the pelvis works, one goes up, the other goes down, one goes in, the other goes out. We have a measured difference, it's a 1 millimeter difference in hip in leg length. That's fantastic. Okay, I'm not worried about that. There's no rotation of your sacrum. That's good. We do have a slight PI-IN or a slight PI where the left hip is just going down 3 millimeters. Okay? If that's there, we deal with it. But again, that's not as significant to me as you can see looking at the tailbone here.
Yeah.
You do see that, yes?
Yeah.
Now let's go to the next. So after the tailbone, that's where we're probably going to start. Now we look at L5, the first floor. Okay? And L5 is doing what? It's tilting up on the right. And it's taking all of these vertebrae with it, creating this slight curvature, right? Okay. This slight curvature balances out where? If we take it back up, 5 goes off, 4 goes with it, 3 comes back. And the next one to go off is L2. You see what I'm doing here? Okay. 2, 1, back to 12. 12 comes back to level. Next one to go off is 11. Yeah, you played hard, yo. Nice. You played hard. Well, I'm looking at the bones here, and they're kind of concave. That means a lot of compression. A lot of compression.
Yeah, my whole body, upper body always feels like it's
compressed, right?
Compressed in, yeah. Especially my stomach area. I feel like I just need it to be stretched out so that everything can actually move properly.
Exactly. Good. Okay. 12. 11 goes off. 10 goes with it, 9 goes with it, 8, 7, 11, 10, 9, 8, 7. And then guess what, man? 6 goes off. And guess what the major nerve to the stomach is?
That one?
6.
Is that up by here?
That's in here.
That's why that thing hurts all the time.
That's your digestion.
Oh.
Now look, 6 takes the whole neck off. Basic structure, okay? We'll go into more detail in a second. I need you to see that. So your potential, you have a 6, an 11, a 2, and a 5 potential. But none of that matters without the
tailbone.
Thank you. Perfect. She gets it. I like it. Good. Now let's go up. Let's talk about, we talked about the digestion. We do have, I'm pointing it all out, okay?
Yeah.
You see this end right here? These little white pieces at the end of your ribs?
Yeah.
We call that little flailing of the ribs, little excess calcium at the end of the ribs.
Hmm.
When I see that, and you know, I learned this from a doctor, 17, 18 years we're doing this, we need to check the thyroid.
Hmm. Okay.
Have you had your thyroid checked?
Yeah, I had blood work recently and the thyroid looked okay, but
Can you please send it to me?
Yeah.
We'll look at it a little
Yeah.
different, okay? So the thing with the thyroid is the values and the reference ranges have changed over the years. They're too wide and varied. I'll go over that in detail when you bring that to me, okay?
yeah.
And why I say digestion, so you understand, we talked about gas and undigested food. It's this little piece here too. This is called the Blvd, the gastric air bubble. This air bubble should be this big, half a circle.
Whoa.
So if we don't have that air bubble, and then I'm seeing all this stuff in here, digestion. We said control of digestion starts where? Around here, 6.
Mm-hmm.
But it can be anywhere. There's, if you want a clinical term for it, it's called hypochlorhydria, low stomach acid.
Yeah. Oh,
So
yeah,
you're
yeah.
not digesting the
My
foods.
stomach acid is really bad.
Okay, and we'll look at it urologically. We'll talk about if we're going to add a couple of supplements short term or not, or we're going to do it in the foods. Okay, you understand all this?
Yeah.
Okay. Questions on any of this?
No.
Okay. Oh, you're in for a treat today. You're in for a treat today. Now, let's talk about the discs on the side, okay? Let's talk
Okay.
about your discs. And this is what I said. So you're telling me sciatica, left side. Let me go back here real quick. You said left side, left side. That could be the ilium, left ilium. Left pelvis, left ilium. So it's down. It could be that.
Mm-hmm.
But neurologically, it could be the sacrum. Could be down the tailbone. Once all that's fixed, now this is why I said old injury. The shape of this disc, that's a nice disc. These are great discs.
Mm-hmm.
That's a 15-year-old injury.
Yeah,
Okay.
that's the one.
Got it. Okay, so you get that. Now, the curvature is fine. Discs are fine. Discs are fine. Look at this one. This is very subtle. That one's kind of level, right?
Mm-hmm.
Pretty much parallel. That's parallel. You see how that's swollen in the back?
Mm-hmm.
That's the 6.
Mm.
Let's look at your neck curve. Okay.
Ooh.
Okay. So this is your normal neck curve. It's actually not bad.
Oh, good.
No, you're actually. This is actually a near normal textbook neck curve.
Oh, good.
Okay. So you compensated well.
Okay.
C2, C3, C4, C5, C6, C7. Now you go back into extension. What happens? C3 is pinching a little bit. Probably get a little difficulty breathing. 2, 3, C4 also. So 3 and 4. Isn't that similar to what we saw? Yeah, okay. So 3 and 4 pinch a little when you're up. So I'm assuming if you're trying to swim and stroke neck up, it's a little challenging.
My neck just always, not always, but a lot, like gets tight a lot and I can't even
Turn left,
it.
right?
Yeah.
Okay, so the muscles will probably activate in response. Now let's see if we have an answer here. Okay, so in flexion, they should all move forward, yes?
Mm-hmm.
2 went a little hypermobile, 3 went hypermobile. So you don't want to be touching that.
Mm.
That's not the issue. 2
Yeah.
and 3 is hypermobile. 4. 5 is back a tiny bit. 5 doesn't go forward. Tiny bit.
Mm.
Do you see how it's tilting?
Yeah.
Slightly. Possibility, maybe at
Mm-hmm.
2, 3, 4, 5. So maybe 5, but I'm not so excited about the neck right now.
Right.
Okay? If there's an upper cervical, we'll deal with it. If there's something going on upper cervically. You want me to deal with your deviated jaw too?
Yeah, it keeps cracking on this side and
On
like
the
on the
left side?
left side, but it could be coming
It's
from
coming
the right
from the
side.
right side.
Yeah,
But we'll test it.
because it's
So
probably pulling it or whatever. Like it's doing.
what do you feel?
I don't know. I just know it cracks on this side, but
Cracks or pops? Like a grind or a pop?
I don't know. Like sometimes I'll open it and it'll like crack and it feels like it's like moving.
Okay, we'll figure it out.
Yeah.
Here's what I want you to see. You see this is the right, this is the left. It goes this way, right?
Uh-huh.
The
Oh
clay,
yeah, interesting.
it goes that way. So when you open your mouth, your right side goes towards the left. We'll test it out.
Yeah.
What it looks like is the left is compensating,
Mhm.
and that's why it's cracking.
Mm.
But we'll see. And all of this can be a result of upper cervical. Now, you said the concussion was on which side?
Left.
Left side. I'm pretty sure we're going to get something on that left side. It's swollen on the left side compared to the right. It's very subtle.
Mm.
You played hard, yo. That's good. You see, I keep saying that, right?
Mm-hmm.
And you're going to keep playing hard. Don't worry.
Yeah.
All
Well,
right?
I'm nothing really can. I mean, this is temporarily pausing my stuff, but I don't really stop. So.
You ready to get started?
Yeah.
Okay. We're going to start by seeing you walk. Okay. So what I want to notice first is just like in the x-ray, you can see this is the upper back, this is our foundation. These should line up. So this is too far behind over here. Second thing is you can see the development. This looks a little bit higher. Actually, it's a little misleading. Okay. The right side is actually higher. So the right side is higher, but the left side is winging a little bit. You can see this bump a little bit more pronounced on the right side. But most important, we know the walking is a little challenging and difficult. We want to evaluate, we'll look at the walk, but we want to evaluate the pelvis and foundation. We're looking at these two dimples. And these are the dimples or the PSIS in the back. And the way they should move, they should go up and down like this.
Mm-hmm.
Okay? We don't want to see no wiggle and jiggle this way.
Mm-hmm.
Okay, let's walk towards the nervous system poster, please. Just regular walking, whatever it is. Keep going. And you're going to do this several times, 4, 5, 6 times, okay?
Okay.
You can see that right side doesn't really move, okay? And you can see how she swings that right leg when she walks. Okay. Keep going. As you're walking, what are you feeling in the body?
It's just this left side is super
Yeah.
tight, so I walk a little weird right now.
Hamstring is tight or the whole thing?
No, it's just the
glute.
glute thing.
Okay.
Yeah.
Keep going. So the glute gets its power from where? What nerves? And then also inside the glute and the hip, you got the piriformis muscle, right?
Mm-hmm.
You got G medius, G minimus, max. All that's coming from that sacrum.
Mm-hmm.
Power all comes from there.
Mm-hmm.
So just let's evaluate. Let's look at the walk. You can see it's off. It's not a smooth, balanced movement. They kind of switch back and forth. Let's have her march in place. We'll get a better look. Knees up a tiny bit more. Arch is fine on the right side. She kind of wants to turn the left one in. My hand is here. Close your eyes. And as soon as she closes, I'm right here. You can see the balance is off. That's upper cervical. Eyes closed is cerebellar function. Okay?
Mm-hmm.
Eyes open, please.
Eyes open. Oh,
Yeah,
keep going.
keep
Oh, okay.
Cool. Come over here and have a seat. Let's get started. Starting at the base of the neck. Let's see. So we're getting it left side around C2, C1, C2 left side, about 10 points, okay? That's the first thing I'm getting. Next thing we're getting is around that T6, about 5, 6 points. Okay. 10 points. There it is.
Yeah, whatever that was.
It's down low. Well, 5 is there, but it's actually down low, S3. Right there. Still going. S3, S4, T6 area, C1, C2. Those are the 3 pressures I'm finding today. Okay? Let's check the hip movement, please. Scoot forward. to the edge. Feet together. Open and close the knees, please. Open and close. Open wide. Are you able to open? Is that hurting the hip at all?
A little bit.
Little bit, yeah?
Yeah.
Left side only?
Yeah.
Do the left side only. Open and close the left knee only. Good. Open and close. So when she does that, right side is fine. Do the right side, please. Yeah. So when she does the right, the whole left is moving with it. You feel that here?
Yeah.
Okay. You feel it at the top of the joint more or the bottom of the joint? This is the bottom of the SI joint on the left side. This is the middle. This is the top.
I don't know.
All of it?
The middle is the worst, I think.
Right there?
Yeah.
Okay, scoot back for me, please. And let's check the movement of the pelvis again. Top of the joint, left side. Tender.
Yeah.
Middle. More. Same. Bottom. I feel it right there.
Yeah.
Middle towards the top.
Mm-hmm.
And that's more consistent with that PI ilium, because if the ilium is down, the swelling is going to be on the top.
Oh.
If the pelvis got AS or up, swelling would be on the bottom. Okay, let's do the right side. Let's do the right side.
This actually hurts the left side.
It does, yeah?
Like here.
In the glute.
Yeah.
Okay. The SI joint is moving.
Mm-hmm.
Let's look at the sacrum now. S1. We're towards me. Good. Now, this is 5. We're gonna deal with that, okay?
Yeah.
That it is there, but it's not starting there.
Yeah.
We got to be down in P3, P4 in the basement. Check it out. Right, that's it.
Sorry,
Okay.
I laugh when I'm in pain, so
It's
just
okay. That's all right. That's your defense mechanism.
It is.
Because if you cried or yelled or whatever, it didn't work. I had a guy who laughed just like that.
Yeah, I'll always.
4 older brothers, and if he cried or showed weakness, he got beat.
Oof.
I'm not saying that happened to you.
No.
Everybody has their defense. L5, S1,
Oh.
S2, or S3. Yes? One more, please. S4. They're all sharp, yes?
Yeah.
Do you feel this? It's starting here, S4.
Oh.
Okay, so S4.
Uh-huh.
I'll give it a second.
No, it's okay. I'm okay.
S4, T6. Now let's check up top and continue, okay?
Mm-hmm.
Scoot back for me, please. Now, 7. 6, 5, 4, 3.
Oh.
Sorry. Remember though, it's compensation, right?
Yeah, yeah.
Head down, please. That's 2. It's tender.
I feel that.
That's 3. It's tender. But we said that's hypermobile. Right there. Right side. Left side. There. Okay. Let's check the occiput and the nodding of the occiput, please. Up and down. Up. Right side. Okay, so the right occiput, primary motion nodding in the occiput. That's good. No bueno. Left. There's swelling in C1, C2, but also in occiput. Occiput ain't moving. Up top. And that could probably be from that concussion. Check this out. That's occiput.
Ooh.
That's C1.
Wow.
That's C2. They're all tender, right?
Yeah.
Okay. Here's what we'll do. We're starting in the tailbone for sure.
Mm-hmm.
Let's do that one first.
Okay.
Have you walk after that, see what happens.
Okay.
And then I want to reevaluate if that occiput or atlas is there.
Okay.
And the 6.
Okay.
Okay?
Yeah.
Ready?
Yeah.
Questions?
No.
Let's do it.
Mm-hmm.
Remember, I'm just doing my job and I'm pointing all this stuff out, okay?
Mm-hmm.
But the main thing is all of this is starting here.
Oh.
And that's part of your sacral chakra.
Mm-hmm. What is that one? The
S4.
no, like the sacral one. What is that control again?
That's the base. That's the foundation. Right?
Oh.
The root is red.
Mm-hmm.
Root is red. Sacrum is orange. Slide up a little bit, please. We'll get into more of that later, okay? Right now we got to get this set. Shasha, can you hold, please? Nice and easy there. Deep breathing and out. Good. Deep breathing and out. Deep breathing. She's holding the legs so they don't pop out. There you go. Deep breathing. Now just normal breathing, please. Good. Gotcha. That's it. I'm holding. 5, 4, 3, 2, 1. I got you, lady. That was it. All right. Don't touch up. And march in place just a sec. And let's walk it off.
That way?
Yes, ma'am. Same way. Just keep going, and then we're going to continue on the side to get more, okay?
Mm-hmm.
Keep walking, please. All right. Keep walking. Keep walking. And as you're walking, tell me if anything has changed. Good, bad, doesn't matter. And if there's
I
nothing,
think so. Yeah.
there's
Well,
nothing.
yeah, I think on the left side where it's been really tight, like I haven't been able to really extend my leg like this, like to while I've been walking.
A little different.
Yeah, it's definitely. Yeah, it's definitely better. Once it adjusts, like the adjustment you did, like once that happens, does it stay?
Well, that's the idea, right? That we're starting the process.
Hmm.
And what happens, and this is how I like to explain it. It's a good question, by the way. Check it out. I start on the tailbone, but we are going to work on 5. 5 is, instead of being here, 5 is doing this.
Hmm.
I make the adjust. Now, these ligaments in the back have shortened, these have stretched. Muscles have adapted. I make the adjustment forward. Within 3 days, 4 days, it does want to go back. Why? Because of the ligament memory.
Hmm.
We change habits starting today.
Mm-hmm.
You're active, so it should be easy for you. My normal homework is 10 to 12,000 steps a day.
Okay.
You swim, all that, fantastic.
Okay.
I would avoid the bike just for a few days.
I haven't cycled for a month now.
Okay.
I can avoid it for as long as you need.
Okay, so
Yeah.
walking and swimming is all I need you to do. Okay?
Yeah.
So that's a good question. But without setting your tailbone, guess what? Your 5 would never hold.
Mm-hmm.
That's the whole point of the lesson today. Does that make sense?
Yeah, definitely.
Good. Now, I'm still on sacrum, and I'm purposely putting that side down so we don't disrupt the pelvis yet.
Mm-hmm.
Bottom leg straight, top leg bent, slide your whole body forward. Good. Nope. You're used to those other guys. Sorry.
Mm-hmm.
We try to keep everything as neutral as possible, okay?
Mm-hmm.
Up on your shoulder. There we go. Down. Relax there. Hold there. Is that okay?
Mm-hmm.
I'm down low still, okay?
Mm-hmm.
There we go. Good?
Mm-hmm.
Just like that, okay?
Mm-hmm.
Gotta get that elbow down. Home run. Gotcha. Give it a second. You gotta see her for this one. This is good. Now, come up slowly, please. Push yourself up, swing your legs down. I'm gonna make sure close to the back. Let's walk it off. Check it out. A little different.
Yeah.
Walk 2 more times, and then I'm gonna recheck everything, okay?
Okay.
You got it. Awesome. 1 more time. Awesome. Have a seat. Let's recheck. Rescope. Mira. Look at that and look at this now. Is that sitting comfortable?
Mhm.
Does that feel different?
Yeah.
Because now this isn't so far back.
Mm.
It's more in alignment with the lower body. Awesome. Head down, please. Still there up top. But guess what? That cleared the mid back.
Mm.
So whatever I'm talking, this is the digestion part. All of this came from here.
Yeah.
All right? That's the take-home message.
Most of my health issues started after the disc, but which was probably the tailbone.
Yes, ma'am. Exactly. You know, straight up, in the last 2-3 years, I would say, 85, 90, 95% of all new patients started at tailbone injuries here. That a lot of people miss because they don't look at it. Because they don't believe it, that it is an issue. Okay, now the occiput. We got to get that old concussion sorted out, okay?
Please.
And I got to check your jaw.
Yeah.
And I'm going to check jaw before and after. So go ahead and let's check the jaw first. We know the left occiput is there. Drop the mask for me, please. I'll put gloves on for your jaw. Look up. Slowly open the mouth. And we're looking at the first thing that deviates. Oh, interesting. It's actually the right side. So the right goes out first, very fast, and the left does what? The left compensates. Yes?
Mm-hmm.
So it is the right, left is compensating. We'll do the occiput and we'll do the TMJ.
Okay.
Okay, you want to put it back on, you can put it back on or off, whatever you're comfortable with. Nice and easy there. Is that okay on the ears?
Mm-hmm.
Good. Good. Look up. Home run.
Mm-hmm.
Beautiful.
Whoa.
What happened?
Huh?
You okay?
Yeah, no, in a good way. Sorry. Wow. I feel like I could go to sleep now, finally.
Yes, ma'am. I stayed in the parasympathetic nervous system for you, okay, today?
Mm-hmm.
Up in the penthouse, down in the basement. Turn left, turn right.
Mm.
Okay?
Yeah.
Nod. Right side. Left side. Ah! Walk it out. Check it out. I got a lot more good stuff, alright? We're going to deal with your ankles next, and then we're going to tune up the shoulders and everything else.
Yay.
Okay?
Thank you.
You're welcome.
Are the jaws fine? Are the jaw?
We'll check it out.
Oh.
We'll check it out. Last thing we'll check, okay? I'm giving your body a little time for the adjustment. Different?
Mm-hmm.
Okay, come over here, go on your back.
Oh.
Hubie!
What is that?
That's your talus, that's your ankle sprain. This one is worse.
Right side is worse?
This one is out more, so you've probably been compensating on your left, all that. You feel that? And that. Okay, now here's how we're gonna...
How did I get those?
Those are old ankle injuries that were never fixed.
Oh,
So here's the thing, it's good info. You deal with sports, right?
yeah.
You deal with a lot of athletes. I deal with a lot of athletes back in the day. Slide down with the pillow. So in the ankle, there are 6 major misalignments that can occur with an inversion sprain. It starts with the talus. Talus is considered the keystone bone of the entire foot. 85% of all foot problems is because they sprain an ankle. Here's how we're going to test it, okay? Heels together, bring your toes back as far as you can. Come look at it from the top. Get a little close, please. Now, which one doesn't go back as far? Interesting. The left one is worse, but the right one felt like it was popped out more.
Hmm.
Okay, so between the two, when the talus misaligns, it goes anterior superior and up. Yours is tilted on the medial side. Okay, so it limits dorsiflexion. Okay, we're going to deal with this side.
Okay.
I'm going to do some lotion for the scar tissue,
Okay.
as much as you can handle.
Okay.
It's not fun.
Okay.
It's not fun, but it's okay. Now, the more we can get the scar tissue out, the easier the adjustment, okay?
Mhm.
And we're first going to work the periarticular swelling. That's a swelling on the outside.
Mhm.
Hi, how you doing? Ah,
Ooh.
oh, I'll there. You know what I'm saying? You know what I'm saying.
Oh.
Right there. That's it. That's it. Let it go. We're almost there. Let it go. 4, 3, 2, 1. Passive range of motion. You know what? I am going to set it. It's ready. Let me call Shasha. She'll help. So she'll stabilize your tibia so we don't disrupt up there.
Okay.
It just feels right. Madam Shasha, can you help me? And we're going to work on her left ankle. If I can get you to hold her left tibia, Shasha, that would be great. Ready? Hold right here. Closer, closer. Firm. Gotcha.
Oh.
That's the home run, lady.
Oh.
Yep, thank you. Check it out now. Feet together. Bring them back. Bring them back, 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 back. Stand up and walk. Now tell me the difference. Turn to the side. She like?
Yeah.
Good. That's definitely different now. Walking wise.
Yeah, I could feel it a little bit.
All right. Have a seat over here. Now you get a buff and polish. And let's go ahead. Five, 4, 3, 2, 1. Halas. Walk it off now, please. Last one. Have a seat after that, and we're going to do the shoulders. What you think, lady?
Feels good.
Little different than what you've experienced, or same?
No, it's definitely different.
Different. Have a seat here. Let's work on your shoulders now. You ready for more?
Yeah.
Okay, ears first.
Oh.
Oh! Shoulder time. I'm reaching over you, okay? This
Yeah.
way. Over, around. This is the right shoulder. There you go. Nice. Nice.
Oh.
Home runs. Good. Stand up, please, and now let's do the hands. Squeeze. Squeeze. What I'm feeling are all the bones on the kinetic chain. Your elbow is out, radial head. Squeeze. Bueno. You're smiling. Good. Squeeze. What does that mean? Those beads.
It's just it's a crystal for I think it's shungite for EMFs.
Oh, okay. Got
Yeah.
it. Cool. Does it work?
I don't know.
Radial head. There. Lunate. Squeeze. But that's not the defense mechanism laugh. That's a good laugh.
I don't know what that is.
Scaphoid lunate.
Oh, I felt it. Oh.
Aye. Go like that 5 times, please. And squeeze. And squeeze. We're good?
Yeah.
Questions for today?
No, I'm good.
Okay, we'll deal with the breathing stuff next visit.
Mhm.
Okay, your homework is very simple. Water, walking, ice. You can swim as well.
Okay.
Fair
Sounds
enough?
good. Yeah.
Welcome
Thank
to
you
the
so much.
office.
Thank you.